Okay. Today we're going to go over the cardiovascular exam. So I would generally have my patient be sitting without their shirt on so I could get a full view of their chest. And after examining everything, I would go ahead and auscultate. I will start at the aortic, going to the pulmonic, the tricuspid, and down to the apex. So we're going to listen to the aortic, which is the second intercostal space on the right. And we'll go over to the pulmonic, which is the second intercostal space on the left. And then the tricuspid, which is through the third and the fifth intercostal space. And then the apex. Okay. And when I'm doing that, I'll be making sure I'll be listening for any heart murmurs, any heaves, any lifts, any extra heart tones. And during my exam, I would make sure to use both the bell and the diaphragm of the stethoscope. All right, I'm gonna go ahead and have you lay down. All right, so while my patient is laying, again, he would have his shirt off so I can inspect everything. I will inspect his carotid arteries here, and I can go ahead and palpate both of them. And at this time, I would also measure for jugular vein distension for JVP, and on a normal patient, it would be under 3 centimeters. And when I'm palpating the carotids, I'll make sure to check the amplitude and checking for any thrills, things like that. So I'll go ahead and listen over the carotid, checking for any bruits, things like that. Also, while my patient is laying down, I'll go ahead and inspect his chest, making sure that I don't note any pulsations or things like that. That would note that there's a weird pulse. I will palpate, feeling for any heaves, thrills, or lifts. So I'll go ahead and do that now. Again, palpating in all those areas. The second intercostal space on the right. Second intercostal space on the left. Going down the third, the fourth, the fifth. And then checking for maximal impulse, the apex of the heart. I don't know any heaves or lifts, so I'm going to go ahead and auscultate in those 4 areas, checking for any murmurs or extra heart tones. right, that sounds good. And I would state any findings, negative or positive. So I noted a regular rate and rhythm. I was able to note S1 and S2. I did not hear S3 and 4. I did not note any murmurs or splitting. Also for this patient, I would have them doing the sitting, the lying, and then I could have them lean forward a little bit and also do the left lateral position to get a little better listen to that heart there. So, all right, I think I got everything.